to talk a little bit about choosing the right rehab center for a loved one. And most times, like I said in a previous video, it's short notice, you're in crisis mode, you work full time, you're like, how am I going to choose a place that I feel comfortable putting my mom, dad, or loved one in? I would recommend, and take my recommendations with a grain of salt, this is just based on experience from my side of working in this industry. I would just choose 3 places and I would walk in. I wouldn't call and make an appointment. Make sure you don't go on a weekend though, because probably you're not going to have anybody to really show you around, because on weekends you're going to have people that are just doing care for the residents and you don't want to interrupt that if you can help it. But if you have to, it's okay too. So when you walk in, look around, just look around. It's like buying a home. You walk in, you're like, does this feel good to me? And keep in mind, you want to keep the loved one's feelings firsthand, because you walk in and you think, oh, this is like a beautiful community. It's got all the bells and whistles. I'd love it here. But you're not the one moving in there. It's going to be your loved one. And chances are they're going to be a little bit older. Sometimes younger people go too. And we'll talk about that in some later videos. But you walk in and you see this beautiful place, but mom lives in her home that she's had for the last 60 years. It's very modest, and that's where she's going to be most comfortable. So think about it. If you go in and it's like beautiful, that's great to look at, but you really want to get down to what they would be most comfortable with. If it's a really comfortable community, maybe not the newest, that might be the best option, because care is going to be the most important. And of course, food. And we'll talk about that one in another clip as well, because that's its own whole ball game. So you walk in, look around. Do the residents look happy? Do they have a bunch of people stacked up at the nurse's station in wheelchairs sleeping? You'll see that many times because nursing facilities are short-staffed mostly. And the staff to patient ratio by state guidelines isn't what you would want it to be. It never is, because you want your loved one to get the best care, but it's not going to be one-on-one care. So look around. Are the nurses stacking everybody up at the nurse's station because they have to keep an eye on them? That's not really fair to those residents, because they may want to lay in bed and do something in their own room, but they may be a fall risk. So they're going to keep them out there or to keep an eye on them. Look for things like that. Look at, if you go during a mealtime, maybe look and see what the food looks like. See if the residents are enjoying it. When you walk through the community, the biggest thing I did when I was touring a family is I engaged staff and I engaged residents, because those are going to be the 2 most important people there. The residents first and your staff, because staff work hard for the most part. We all have some bad eggs around, but I think most people that work in this industry do it because they love doing what they do. So just look around. Does it feel right? You know when you have a gut instinct that it doesn't feel right, and that's okay if it doesn't. Just move to the next one. And if once you've visited 3 or 4 or as many as you want, I would recommend 3, then make the decision. If you can involve your loved one, even better. Even just taking them information, taking pictures of the outside, maybe showing them a room. I mean, obviously you can't take pictures of the residents because that would be a HIPAA violation, but just walk in and your gut will tell you, just by meeting the people and the residents, whether it's the newest community or the oldest, look at that. Go to the therapy room. Therapists are very, very smart people. They know how to work with older adults in that setting. And you want to see how active they are in there and what kind of exercises they're doing. And again, I mean, people need their privacy, patients do, but many times they'll want you to come in and they'll want to talk to you and engage with you. So I would recommend doing that. And then once you've made your decision, then you would ask the nursing rehab center to go assess your loved one. And we can talk about that a little bit more in the next video, and just keep watching. And if you want longer videos, I'd be glad to do it, but I'm trying to keep them a little bit shorter, even though this one's a little long, just so if you're short on time, you're able to just watch little snippets. So thanks again for watching. Hope you all have a great day.